Welcome to this edition of Buncombe Life. I'm here at Mission Health in the Mission Heart Tower. It's brand new, it's beautiful over here. And Dana Blake's going to join me, and we're going to talk about women's heart health. You need to hear this, even if you're not a woman, so stay tuned. All this year, you're going to be hearing a lot of health issues because Buncombe County employees are going through something called Buncombe Wellness. We're all trying to get physically, mentally, and financially fit so we can serve you better. We want you to join us. So all throughout the year, we'll be doing segments on health. Like I said, mental, physical, financial, to get greener, safer, smarter, healthier, kinder. And today we're focusing on healthier, women's heart issues. So stay tuned as we join Dana and she tells us what you need to know about women's heart health. Okay, I'm here with Dana, and I'm going to get her to tell me what she does for Mission in just a minute. But just like I just told you, men's heart, we have talked about that. We've talked about heart issues, but women's heart issues we have not, which is pretty normal. Women kind of get left out when it comes to heart issues, and you're going to hear in just a minute why that is and why we don't always pay attention to what we need to. So, Dana, thank you. First of all, for being here with me today. Dana Blake, what is your job with Mission?
I am the Heart Outreach Coordinator, and what that means is I go into all 16 counties in western North Carolina and host and coordinate health events for the underserved and uninsured. It's not always that population, but a lot of times that's what we like to target, and we host free health events where we'll do a total lipid profile for folks, blood pressure checks, sometimes in faith congregations, sometimes in unsubsidized housing projects, those type of things, and a lot of times we'll schedule a cardiologist to come into a housing project and just talk about heart disease and how to prevent that, recognizing the signs and symptoms of heart attack and when to call 911 and when not to call 911.
That's right. That's right. Because heart issues are important. And I had a little, and I told her this a few minutes ago, I had a little statistic here that said heart disease is the leading killer of both men and women. If you ask me what's the leading killer, I'd say cancer.
Right, because October will always see as pink. We see it everywhere, and
right.
It is very important. I don't mean to take away from it at all, but we don't see as much red in February. We don't have quite the funding, but it is the #1 killer in the United States of both men and women.
Both men and women. And it's a big percentage of of the deaths in women. But you don't hear that. I hate to say that, but whenever I think of heart attack, I think man.
Right.
But there's a big number of women.
Right. And I sit on the American Heart Association's Advisory Council, and we're working really hard to get that message out, especially in February. It's a national campaign, with February being National Heart Month. There's a huge campaign to get the word out because, obviously, I'm a female, you're a female, and
that's right.
I have heart disease on both sides of my family, and I'm very passionate about it. One of the reasons I'm in this role. Women tend to do caregiver positions. We take care of our families, our mothers and fathers, our children, and we tend to kind of ignore our signs and symptoms, and that's what happens.
We don't have time to have a sign or symptom.
Exactly.
I don't have time to stop. Even if it's a problem, I don't have time.
Right.
And that's the mistake.
Right, that is. And oftentimes, as great as our physicians are, as great as our cardiologists are, our hospitalists, we come into the ER and we have these vague symptoms. We don't have that typical, and this is kind of comical, but it's not, but we don't have that red fox, I'm coming to see you, Elizabeth, crushing chest pain.
That's right.
Always. A lot of times we may have jaw pain, we may have arm pain, back pain, just upset tummy, vomiting, those type of things, and we may get dismissed with either depression, musculoskeletal pain, and those type of things, and we're sent away. But one thing that we are gifted with is intuition. So if we have family history and we have that gut instinct, we need to press for an EKG for some cardiac enzymes and really be an advocate for ourselves.
And you have said right there about 5 things I want to stop on. One is this a leading cause of death in women? Heart disease.
It is. It is the #1 killer in both men and women. You stated it in the beginning, in men and women. It's not breast cancer. It actually kills about 3 times as many women as breast cancer.
Did you hear that? And breast cancer is huge. We don't want to say it's not something you should pay attention to, but it kills more. Heart disease kills more women. And I think it's because it's not on the forefront of our mind, these symptoms, because they're not huge symptoms. They're subtle sometimes.
Right.
So I want to stop there, and I want you to tell me about the symptoms of heart disease in women? What should I be looking for if I've got these symptoms happening?
Again, we can't help who we're related to, but if
Right.
you have family history, it doesn't have to be immediate. It could be just a grandparent, but if you have family history of hypertension, cardiac arrest, arrhythmias, research that. Ask around, what did my grandmother die for? A lot of corporate wellness events that we go to, I'll ask I'll ask the patient, do you have family history? No, I don't think so, but as the interview goes on, absolutely I do. I forgot there was a valve problem. That's a symptom. That's something you need to know about. So, and then educate your children and your grandchildren about that too. You need to know, is there family history? That's the number one thing your cardiologist or hospitalist is going to ask about, and that's to include them in. Do I need to do an EKG? Do I need to do some cardiac enzymes?
Okay. Then let's say I do have some history there. I should be watching my numbers. And that's a huge thing with people, and know your numbers. Thank you to Mission, a big part of that, for people knowing what their numbers are. But what should I be looking for in those numbers? What's a red flag?
Well, absolutely need to know your total lipid panel, and you need to have that done every 1 to 2 years.
And the lipid panel is cholesterol?
Your cholesterol, your triglycerides, your HDL and LDL, and those numbers could vary dependent on what your family history is. What you should know, most importantly in my opinion though, is no smoking. Number one thing I see when we audit charts is the cardiologist will counsel people about smoking, and there's all kinds of help out there. I don't pretend to think it's easy to quit because I haven't smoked, but I talk to smokers and I know it's absolutely hard to do. Second thing is exercise, and exercise is whatever that is for you. For me, the thought of getting on a treadmill and standing in front of a television, I can't do that, but I love to hike, I love to swim. That's whatever it is for you. And if it's not 3 times a week, 30 minutes a day, I'm not saying don't do that. I don't want my coworkers to say, you were telling everyone not to do that. I'm not saying that, but get started doing something.
Get moving.
Exactly.
Right.
So your numbers, your BMI, your body fat percentage, your abdominal girth, most people would say, is one of the best indicators of your chances of developing heart disease.
Okay, abdominal girth. That's a nice way to say belly fat, right?
Your tummy. So
it's just right here.
Right.
This part right here.
Right. And most women are apple-shaped. So
Yeah.
go home, get yourself an old-fashioned tape measure and measure your tummy. Most folks would say, or most cardiologists or physicians would say, they want females to be less than 35 inches in the belly. So when I go out to these events, I tell people, if you're more than 35 inches, that's a good indicator of your chances of developing heart disease. 25 crunches at night. Most people can do that. 25 at night, 25 in the morning. That's a good starting point. Is that going to get you where you need to be? I don't pretend to say that it is. You absolutely need to be exercising. And again, I don't want to take away from that. And I don't want a bunch of exercise physiologists coming up to me later saying, what were you telling people? But I'm saying let's meet people where they are.
Right, you got to get going.
Exactly.
Okay, so here and your numbers and your family history, those are all indicators. But there's something you said a minute ago too, and I've heard this before, jaw pain or back pain in women.
We've even had people come into the ER, and this just resonates in my mind more than anything, toothache. Who would have thought? And, it's happened.
And that's been a heart attack, not a toothache.
Exactly. And again, it's rare. It doesn't happen often. I don't want to give that misconception.
Right.
Trust your instincts.
Right. Right. If you think it's back pain, jaw pain, you just don't feel right, you've got these indicators, you need to go get checked.
Right, and I don't want our cardiologist coming to me saying you told everybody with a toothache and some arm pain to come in and say you're having a heart attack. You have common sense. Think about it. Do you have some sweaty, we call it diaphoresis, are you sweaty?
Right.
Are you vomiting? Do you have family history? Are you obese? Do you have a big tummy? Think about the things that I'm saying. Do you have a couple of these factors? If so, call 911. That's a big takeaway from this too. We still have people, especially in Western North Carolina, that think it's the right thing to do. Drive your loved one to the hospital.
Yes.
Never ever the right thing to do.
It is not. And if you've watched this show, anytime you've heard me, we made that mistake. Call 911. It's why they're there. Another thing I wanted to say too is, I read this, but you said it was true. Women go undiagnosed until it's too late to help them. And that's what you're talking about. Get ahead of this thing.
Right. And a lot of times when we're teaching CPR, we always try to stress the fact that it's important, obviously, the compressions are for the heart, but more importantly, they're for the brain. So you can experience a heart attack. There's about 8 to 10 minutes worth of oxygen in the heart while you're waiting on EMS, which is the national arrival time.
Right.
But those compressions, while someone is experiencing a heart attack, they most always will go into cardiac arrest. One takeaway from this message is you're saving the brain tissue. So Mission's famous, top 50 hospital in the nation for saving people from heart attacks. But what happens is loved ones are forced with disconnecting people from life support because brain tissue died.
Right.
It dies in 4 to 6 minutes. So if you don't start those compressions, God forbid somebody does have a heart attack and go into cardiac arrest,
Right.
you must start compressions.
Okay, how do you know they're in cardiac arrest?
They've collapsed.
They've collapsed. They're passed out.
Right. And people may say to me, so what if it was diabetic, a coma? What if it was a seizure? You can best believe if you collapsed and I get on your chest and start doing compressions, if it's not true cardiac arrest, you will tell me, get off of my chest
Okay,
immediately. So
okay.
that's a good way to know.
That is a good way to know. That is great information because I've always wondered that if somebody passes out, I don't want to hurt them. What if they don't need it? If they don't need it, they're going to tell you.
Absolutely, and I tell my children that. My 7-year-old, is she going to be effective at doing compressions on me? Absolutely not. But she can give this same spiel to anybody because she goes to these events with me.
Right.
She knows very first thing, call 911. Second thing is start pressing on my chest.
Right.
Is she going to be effective? Probably not, but she knows to tell the neighbor, start pressing on my mommy's chest and don't stop. You don't have to do mouth to mouth any longer.
Right.
American Heart took that piece away because North Carolinians said, number one reason I don't jump in and do anything at all.
I'm not doing that part.
Right, so you don't have to any longer. Hard part of your hand, center of the chest, you start doing compressions and you don't stop.
Right.
So that's a big takeaway too from today.
That is excellent, excellent information. Okay, the main thing they can do, if you've got family history, if your numbers are bad, if you've got the apple shape, got the problem here, is to change their diet and lifestyle.
Yeah, and really no smoking. I mean, and
no
again, that's a
smoking.
huge takeaway as well.
Yes, that's just a give me anymore. No smoking. Smoking for any reason.
Right, and
is
even,
wrong.
smokeless tobacco too, that's important. Most people
right.
think that that's a good alternative, but it's not.
No, it's not. So what is the number one thing we want people to take away is the compressions, and if you stay tuned, we're going to show you how to do those compressions, and that'll be next, so you got to hang on. What's the other thing you want people to know, the number one thing you want women to know about their heart health?
Again, trust your gut instinct. If you can't take care of yourself, you can't take care of all these people that we love. And
That's
that is
right.
what we're just great for. We're great at being caregivers. Listen to your body. If you're having these atypical signs and symptoms, seek help. Don't let people talk you into driving yourself to the hospital. Buncombe County and Henderson County do really well about that. Some of the more rural areas, and I get it, they think, I can beat the ambulance there, but these ambulances have ways to transmit these EKGs to the hospital and activate the cath lab after hours. So your cardiologist is waiting on you. That team is waiting on you. So if you drive yourself here, you have to wait for them to get here, which they're still pretty good about that. But time is tissue. This tissue doesn't rejuvenate. This tissue doesn't rejuvenate. So if you activate 911, they get there, they transmit that EKG, they're there waiting on you. So the takeaway for me is start compressions and call 911. It's never the right thing to do to drive yourself or have a loved one drive you there.
And you might not make it.
Right.
That's right. Thank you, Dana.
Thank you so much.
Thank
I
you.
appreciate it.
That's right. Stay tuned. I hope you found that interesting. Women's heart issues are very important, but we've got two more things we want you to know about. One is there's a new way to do CPR. The old way was always encouraged, you always had to put your mouth on the person, and I'm sure that kept a lot of people from using their CPR technique. That's gone. You need to watch this very short video because everybody needs to see this and how to do CPR.
My name is Brian Asbell. I'm a cardiologist with Asheville Cardiology Associates and Mission Heart. I'm going to briefly show you how to do hands-only CPR. If you find a patient who's unconscious, the first thing you want to do is call 911, or you can have someone else who's nearby call 911, and then you want to start hands-only CPR right away. The proper way to do this is to use two hands, interlock the fingers, find the breastbone, the sternum, the hard part of the chest between the ribs, cross your hands like this, keep your elbows locked, and then initiate compressions at a heart rate of about 100 beats per minute. You want to depress the sternum or the breastbone about 2 inches with each compression, and you don't want to stop. If you're by yourself, as the rescue squad is coming, and you get tired, you can shake your arms out for just a moment and then go right back at it. If you have someone who's with you, you can switch off as long as you make that transition very quick. The national survival for out-of-hospital arrest is about 8%, and you can make a tremendous difference if you'll call 911 and begin hands-only CPR right away.
Now I want you to hear about children's heart issues. If you've watched our channel much, you've seen this before, but it's worth watching again because it's actually shocking. He's going to tell us about some pediatric heart issues. We know that women's heart issues aren't focused on very much, but children, and I'm talking about children, are now having cholesterol issues. You don't believe me? Listen to the professional. He's going to tell us all about it next. I'm glad you're still with us because I think this is going to be very interesting for you to hear. I'm here with Dr.
Brad Friedman.
Thank you. And you're a pediatric cardiologist?
That's correct.
Is that right?
Yep.
I know there's a lot of issues dealing with heart issues in kids, but the one we want to focus on today is one I don't think hits anybody's horizon. They just don't really even think about it. Mm-hmm. That kids could have heart issues because of diet and things that could be prevented that drive them here. Tell me a little bit. Let's talk a little bit about that. What do you see?
Well, I think that it's a tremendous issue that you bring up, and a very important one. I think something that people don't realize is that kids that are born today are actually forecast to live a shorter lifespan than their parents.
That's, with today's technology, that should be unheard of. That
Right.
should not be the case. And this
Yeah.
was really surprising when we started doing the piece that folks were watching. To hear this was one of the most surprising things that we learned. If I think of a heart issue, I think 50, 60, 70, yeah, that's when you start thinking about it.
Right.
Not so.
Right, and we're just starting to understand that, and the adults are way ahead of the pediatric knowledge base about this issue, but it's becoming more recognized. New guidelines are out about the importance of screening children for the risk factors that cause atherosclerosis or plaque in the arteries that lead to heart attacks in early life sometimes, in early adulthood. Those risk factors are high blood pressure, cholesterol problems, or what I like to call lipidology or dyslipidemia.
Okay, no, whoa.
Okay.
We got to talk about lipidology.
Right.
That sounds like the study of lipids, but what is that? What is that? What's a lipid?
Well, a lipid is basically a cholesterol particle. Yeah, and that's what everybody understands is cholesterol.
That's
what
the
we're
word.
talking about.
Everybody, thank goodness now, is on everybody's radar is cholesterol. I think people know it's not good. I need to keep it low. There's a number for adults.
Right.
But cholesterol in kids, you don't even think about that. That's something you shouldn't have to worry about. But you're saying there's a study of that, and you're a specialist in that. Tell us a little bit about that.
Yeah, I've studied an extra year or so in the study of cholesterol, and there's an exam that people take to prove that they're knowledgeable enough to treat people with cholesterol problems, and I've gone ahead and done that, and more people in pediatrics are getting into that and understanding that it's important. And I felt that was important because the guidelines now state that they want to screen every single kid between 9 and 11 years old should have their cholesterol checked.
Wow. And they're doing that.
Mm-hmm.
You're doing that. What are you finding?
Well, we're finding a couple of things. The primary reason for doing this is because we want to find that 1 out of every 50 to 500 kids who has a genetic problem with their cholesterol, which means that they have a genetic issue which makes their cholesterol level extremely high.
Hereditary.
Hereditary, that's right.
Okay.
So if we can find that in those kids and treat those children, we may save years and years, if not decades, off their life, treating them early for their cholesterol problems.
All right, well, I can say the 2 case studies that folks have been watching with this episode,
Right.
if you could have caught both of those guys, they both had hereditary cholesterol issues.
Right, right. And that's what we want to catch.
Right.
That's the primary thing. And the important thing to know about that is it doesn't have to be that somebody's overweight necessarily, or have other external factors that make it obvious that they're at risk. They could still have a major problem.
Because if kids are just eating the diet they watch on television, they're going to have cholesterol issues,
Right.
even probably if they're not hereditary issues. They're just from eating that.
Right, and that's the second main population. We know about the obesity epidemic and overweight epidemic in this country. Western North Carolina is certainly not immune to that. They're one of the worst, unfortunately. We're trying to get better with that. But the obesity problem affects children markedly more actually than adults percentage-wise. The percentage of overweight and obese children is increasing faster than even our adult population. So with that come the problems of high blood pressure and cholesterol and diabetes and those types of things.
But if you can catch it there, you can stop it for a lifetime in many
Absolutely.
cases.
Absolutely. So that's why we preach early intervention and detection in addressing these problems as early as we can.
Now, 2 things I want to make sure that we cover. What is Mission doing along these lines? They've got you.
Right.
You're working here, so that's one of them.
Yeah.
We're attuned to it. We're attuned to it. That's a huge piece.
Right.
We're attuned to it.
Right. Yeah, so I guess the biggest thing that Mission's doing is bringing physicians with the knowledge base to deal with these issues and trying to educate the community at large, educate them, one, about the issues that it's there, and then also how to address it in a community sense.
Right. So they've seen it coming, and now they're addressing it. What do you do? What are some of the things that you tell folks to prevent? Tell parents. You know, you've got a 9-year-old who
Right.
has high cholesterol. Oh my goodness.
Right, right.
What do you do?
So some of the major things are the first steps that we do or try to address diet and exercise. You know, lifestyle modifications. So try to eat healthier, avoid the sodas, the regular sodas, avoid the fatty foods. Don't go to fast food restaurants if you can help that. Don't get the French fries if you're going to the fast food restaurant. So that sort of thing. Try to modify diet, and then also increase exercise.
Get out and run around.
Get out and run around. We all know that's good for us, but it really does change our body chemistry and can change some of the blood pressure issues and then also the cholesterol.
So the things that we've heard for adults, it's for everybody.
Absolutely.
You don't wait till you're 25 to start looking at your cholesterol number.
No, not anymore.
Not anymore.
Not anymore. We're too smart for that now. We are seeing issues with obesity, though, that's not necessarily causing them to have cardiac bypass surgeries or open heart surgeries, but they're having to have orthopedic issues. They're having to they can't sleep at night because of the obstruction of their airways. They have to take medications every day because of diabetes and other things.
And this is shortening that life that you talked about at the beginning, where you're seeing their lifespan's not as great, maybe even as their parents.
Absolutely.
For some of these issues.
Yep, and all of our technology and everything we can do and all of our knowledge, it won't translate into a healthier population unless we make lifestyle changes at the beginning, and we use our knowledge to screen people that have genetic problems and find out issues and then address those issues early.
So would you think that parents that may be watching this and have a 9 to 11-year-old or a teenager, should they be screened for their cholesterol? Should they get their cholesterol checked? Because I think most people in their head don't think, I need to check that till maybe they're 35.
Right. If they wait till they're 35 and they have a genetic abnormality that causes them to have high cholesterol, they could have a heart attack by the time they're 35.
That's true.
Okay, so yes, absolutely, and it's not just coming from me. The American Academy of Pediatrics suggests this. All of the major cholesterol organizations suggest this, and it's a simple blood test. If we can add decades of people's lives and avoid procedures and heart catheterizations and open heart surgery by just figuring out which individuals have this issue,
Right.
I think it's worth a little blood test.
Again, I need to know your numbers.
Okay. Yeah, that's right.
Every age. That was hard for me to believe when he said children between 9 and 11 should have their cholesterol checked. That's when you shouldn't be worrying about your health. You should be out running around happy, but no, our kids have got cholesterol issues. So I hope you'll take that to heart, get yours checked, get your children's checked, and know your numbers. It's good for men, for women, for kids. We all need to know what's going on with our numbers and with our body and with our heart. And as always, as we finish this episode, I'm going to encourage you, stick with us because you never know where we'll be next month here on Buncombe Life.